my name's Ashley. I'm a registered nurse with Serotonin Plus, and I'm going to show you when we have a new patient starting the program, how we proceed with the appointment. First, after they're finished with their paperwork, I'm going to bring the patient back to a room. So if you'll come with me.
Sure.
Okay. Yeah, have a seat. So once we have the patient in the room, we're going to go ahead and pull up their information in the EMR and make sure all of it is correct. We're also going to go ahead and start going over some medical history. So Kelly, just 1 second here. Okay. So some of the information that we go over in initial appointment is some medical history, like what kind of prescription medications you take.
Okay.
If you have any drug allergies. We go over some family history also and your current medical conditions. For example, does your family have a history of hypertension, heart disease? Do you have any issues like that? Thyroid problems, things like that. Hospitalizations and surgeries. And we proceed from there. So, do you have any current medical conditions or any prescription medications that you take?
Nope, not right now.
Okay. All right. And I'm going to look just a second here. Sorry, I'm not logged on. Okay. So if you're looking at the EMR, let's go over this information really quickly. Okay, great. Once we've gone over medical history, medications, then we're going to proceed with taking vital signs and doing the body scan. Okay?
Okay.
So we will do blood pressure, and then we go out and get a height and weight and do the body scan. Do you want me to show the body scan machine? Okay. And I'm tangled.
You are tangled.
Well, thank you. Okay. So Kelly, if we're going to do a height for you, I'd have you put your back hands here. Back hands here. Okay, go ahead and step forward.
Okay.
So you're 5'4".
The machine.
Yes, so we would go ahead and have her step on to get a weight and proceed with doing the body scan. It would print out for us. Once that's printed out, I'd take you back into the room and we'd go over that document.
Okay.
Yes, and the blood pressure. Do you want me to?
Oh, yeah, we'll just pretend.
Okay. So again, one of the vital signs that we take is blood pressure, so I would go ahead and do that.
Right?
Okay. So when we have the document in hand from the body scan, I'd go over that with you. We'd look at your total weight and what that consists of, your water and everything, a skeletal muscle mass, body fat mass, go over your BMI and your body fat percent. So you kind of get an idea of where you need to go.
Okay, so that's where we would get our goals from.
Yes,
Okay.
absolutely.
Great.
Okay. And once everything is documented in the EMR and the body scan is complete, at this point we want to do a physical exam, listening to heart and lungs. So at that point I'd turn it over to Dr. Posner.
Physical. Yes.
Hi, I'm back in the room. So at this stage, I would walk in when the patient's already in their gown and then review their medical history. So what I'd want to know is I'd want to make sure I know what medications the patient's taking, what their blood pressure is, and then the body scan's already been gone over, so they already understand what their weight is and what their percentage body fat is. Now the examination is really a very quick one. We're going to listen to the heart, the carotid arteries, and the lungs. Now if there's any heart murmur that I hear, I'll ask the patient if they've had a heart murmur previously. If they say, oh yes I have, I've had it worked up, that's fine. If they've never been told about that before, depends on the level of the murmur, I might not use the prescription medication. I will start the program. So this program again is not about the diet pill. It's about the entire dietary plan and the serotonin. So if there's anything on the examination that you're not comfortable with, address that issue with the person. If they need further workup, do it yourself if that's person's part of your practice, or refer them back to their primary care doctor and start the program. Just don't use the phentermine unless you're sure. Just like the EKG. Now in our office, I'm an internal medicine doctor, we do EKGs here. So we'll run the EKG after I do the examination. If the EKG is normal, they're full go for the phentermine. Now if you're not in an office that has an EKG machine, if that person does not produce the normal EKG on their first visit, start the program without the diet pill, use the serotonin and the dietary plan, and then when they produce the normal EKG, that's when you can prescribe the phentermine. Now when I finish the brief examination, I will then exit the room and allow the person to get dressed. When they're dressed and they open the door, we'll then have one of our staff people, and Ashley will do this, go over what we do with the medication and supplements.